can come from one plane ride. It can introduce the measles to a whole state. So I was nervous, the team and I were a little bit nervous, kind of holding the perspective that it probably will get here at some point, so we just need to be ready. But I was also a little bit confident. It sounds kind of silly to say, but I really trust our work and the work of public health, trust my team, and I think knowing that we had the ability to start preparing and could get ready for it, I felt confident that we would be able to figure it out, to handle it a bit. So our team in public health, Polk County Public Health, started preparing about a year before we ever actually saw it, back in early 2025. We started with an exercise, an impromptu exercise, where we simulated measles. We've just had it in our county. What are we going to do about it? So we invited all of our public health team members to the table to talk about what we would do, how we would communicate, what actions we would need to take. And then we started planning with providers as well. We developed some guides. We developed a communication guide, really just trying to approach it from several different angles. So once we actually saw it, which would be almost a year later, we would feel at least a little bit comfortable with our first steps. In Polk County, we're a really small county. We have, during the measles response, we had 2 public health nurses and myself who were really kind of leading the charge. And of course, the rest of our public health team had really pivotal roles, but in terms of the actual in-the-moment response, there were about 3 of us in the health department who were working through the process. So we were really reliant on partnerships to help carry our impact. We worked with EMS, Emergency Medical Services, who had a community paramedic who could go out to the houses of people who had contracted measles and check on them, see if they had any needs, make sure that they were staying healthy. We worked with our community food pantry, Thermal Belt Outreach, who was able to provide food and resources to be delivered to those people who were homebound, sick with measles. We worked with our local library. We hosted a central vaccination clinic. We worked with our clinical providers, Blue Ridge Health. There was just a range of partnerships that were really essential for us. We are in Polk County we border Spartanburg County, South Carolina, which was kind of the heart of a really huge outbreak. And we have folks who work in South Carolina or folks who live in South Carolina and work here. So we knew it could be spreading really easily. And trying to keep tabs on that was definitely a challenge. Something that's unique about a communicable disease case, or specifically a measles case in a school setting, we know that children are little disease vectors. They put things in their mouths, and even high school students, it's just, they're in close proximity. It's really easy for communicable disease to spread. And measles spreads super easily through the air, and it can linger in the air for up to 2 hours. So essentially, if someone's in a school, they're sharing the hallways, everybody can be exposed to measles in the same day. So we had to partner pretty closely with the schools once we knew that there was a case to figure out, okay, who's immune? Both staff and students. That includes teachers and even maintenance staff. Who would have been exposed definitely in those shared spaces, and then what are we going to do about it going forward? So the school was pivotal in that response. We had their nurses, their administration reviewing footage, going through records of immunization and immunity, and we were able to track down anybody who wouldn't be considered immune and make sure we took the steps to protect everyone, and it was ultimately a success. What made the difference for us in preventing the spread was getting started early. We talk about preparedness a lot. Preparedness is really essential in the field of public health. My team and I talk about not building the plane while flying it. So trying to make sure that we have some kind of system in place before the threat comes along, so at least we have a place to start and we know who we need to work with and what we need to do to prevent this from blowing into something much bigger. So I mentioned what we got started about a year before, and even when it started to approach us, we heard about Spartanburg County in South Carolina starting to see cases, speckle throughout their region. We kept building our system. And of course, there were always hiccups in the process. Communicable disease knows no bounds, so that things popped up, but because we had those partnerships in place, because we've been communicating about it, kind of building our system, our strategy, I'd say we were about as prepared as we could have been to respond, and then once it was actually game time, we were able to work quickly and effectively, even with a small team. Not everybody can get a vaccination. People who are going through chemotherapy, who are immunocompromised, little youngsters who aren't old enough to get the vaccine, even people who are pregnant can't get the live vaccine. So protecting ourselves, becoming immune ourselves, and building kind of a team, a community who is immune against the measles helps to prevent spread and protect those people who can't protect themselves. So there are a lot of different roles that a person can play to prevent getting a communicable disease in the first place. But even once getting one, reporting it to a trusted healthcare provider and staying home when we're sick can also make a really huge difference. We're all here with the central goal of keeping our families safe, keeping the people that we love safe. And we're in a time of information overload when it can be hard to decipher and hard to figure out what the best way forward is. And ultimately, we all do things differently anyway. But the goal of public health is to support in any way that we can with that decision making, to give an expert opinion or to help connect with resources, to whatever that might look like for a person. We're just here not to judge, but to support.